What if I told you that there is a silent poison in your kitchen that you probably consumed this morning thinking it is harmless? I am Dr. Grace Prescott, and in this video, I am going to reveal the 4 biggest enemies of your kidneys, starting from common habits until reaching the worst of all, a disguised villain that is destroying your filtration capacity drop by drop without you noticing. Do you feel a tiredness that does not go away, or notice your ankles swollen at the end of the day? Kidney disease is a silent thief that does not sound a siren before attacking, and many only discover it when it is too late. Today, we are going to unmask from 4th to 1st place the toxic agents that are prematurely aging your organs, including medications that you take for pain and foods that seem healthy but are not. Staying with me in these next minutes can be the difference between a full life and a dependence on dialysis in the future. I am going to give you the power to identify and eliminate these dangers before the damage is irreversible. If you value your health and want to protect the most important filters in your body, pay close attention, because what I am going to reveal now is going to change the way you eat. To make you understand the magnitude of the danger we are facing, we need to first talk about who the victims are. Your kidneys are not just 2 bean-shaped organs located in the lower part of your back. They are, in fact, the most sophisticated chemists in the known universe. Imagine a high-technology water treatment station that never closes, operating 24 hours a day, 7 days a week, filtering about 180 liters of blood daily. They meticulously separate what is vital nutrient from what is toxic waste, balance your body fluids with millimetric precision, control blood pressure so that your arteries do not explode, and still stimulate the bone marrow to produce new blood. It is a Herculean job. And the most impressive part? They do all this in absolute silence. They do not complain. They do not hurt when they are overloaded. They endure the strain. However, this heroic resistance is also their greatest weakness. As a nephrologist, the most painful thing I see in my office is the patient who arrives feeling just a little tired or with a strange itch. And when we do the tests, we discover that 90% of kidney function is already gone. The kidney has an immense reserve capacity, which means you can lose half the function and not even notice. But when symptoms appear, the swelling, the metallic taste in the mouth, the morning nausea, many times we have already crossed the point of no return. That is why prevention is the only true cure. And prevention starts by understanding that, as we age, our kidneys change. Just as your skin wrinkles and your vision loses focus, the nephrons, which are the microscopic filtration units inside the kidneys, begin to die and scar. A 70-year-old kidney does not have the same resilience as a 20-year-old kidney. It is an old engine. And if you put adulterated fuel in an old engine, it will blow much faster. Today, we are going to talk about this adulterated fuel. We are going to talk about the daily choices that accelerate this natural decline, transforming healthy aging into organ failure. I have cataloged the 4 biggest offenders, the 4 horsemen of the kidney apocalypse, and we are going to start from the back forward, increasing the level of danger with each item. Poison number 4 is not something you ingest through your mouth, but it is something you do with your body, or rather, fail to do. I am talking about chronic sedentarism. You may think, Dr. Grace, what does sitting on the couch have to do with filtering my blood? The answer is absolutely everything. The human body was designed for movement. We are hydraulic machines. For the kidneys to filter blood, that blood needs to reach them with adequate and constant pressure. When you spend 8, 10, 12 hours a day sitting, whether in the office, in the car, or in front of the television, you create a state of physiological stagnation. Your blood becomes slow, viscous. Think of a mountain river versus a swamp. A river flows, the water is clear, oxygenated. A swamp is still, murky, full of sediments. When you are sedentary, your body turns into a swamp. The lack of muscle contraction in the legs decreases venous return. But the problem is deeper. Sedentarism alters your chemistry. Staying still reduces your cell's sensitivity to insulin. This means that the sugar you eat floats in the blood longer, caramelizing your proteins and inflaming blood vessels. In addition, inactivity is directly linked to increased systemic blood pressure. Your kidneys are vascular organs. They are made of blood vessels. If pressure rises or if blood is full of glucose and fat because you do not move, the small kidney filters suffer constant microtraumas. The solution is not to become a marathon runner tomorrow. In fact, sudden extreme exercises can even harm untrained kidneys. The solution is to break the cycle of immobility. There is a concept called exercise snacks. Every hour sitting, stand up for 5 minutes. Walk to the kitchen, take a lap around the table, climb a flight of stairs. Just the act of standing already activates postural muscles and improves hemodynamics. Walking 30 minutes a day is not just good for the heart, it is natural dialysis. Movement helps control pressure and sugar, which are the two biggest causes of kidney failure. If you want to protect your kidneys, the first step is literally to take a step. Now, let us increase the severity. Poison number 3 is something most people have in the bathroom cabinet and use as if it were candy. I am talking about non-steroidal anti-inflammatory drugs, the famous NSAIDs, ibuprofen, diclofenac, naproxen, ketoprofen. Modern culture has taught us that we should not feel pain. Headache? Take a pill. Back pain after sitting all day? Take another. Cramps? One more. They are sold over the counter, so they must be safe, right? Wrong. For your kidneys, these pills can be hand grenades. Let me explain the mechanics of the disaster. Your kidneys have an intelligent self-regulation system. When you are dehydrated or your pressure drops, they release substances called prostaglandins, which dilate the blood vessels that enter the kidney, ensuring blood continues to flow, to be filtered, no matter what happens outside. Anti-inflammatories work precisely by blocking the production of these prostaglandins, because they are the ones that also cause pain and inflammation in the body. It is a double-edged sword. By taking this medicine to cure knee pain, you are turning off your kidney's protection mechanism. The result? Acute renal vasoconstriction. The kidney arteries close. Blood flow is cut off. It is like someone stepping on the garden hose while you try to water the plants. If this happens once, perhaps your kidney recovers. But if you take it every day or several times a week, you are causing repetitive ischemia, lack of oxygen in kidney tissue. Over time, this causes renal papillary necrosis. Parts of your kidney literally die and scar. And the risk triples if you are elderly, if you already have high blood pressure, or if you take the medicine while dehydrated. Never ever take an anti-inflammatory if you have not drunk enough water. If you have chronic pain like arthritis, talk to your doctor. There are other paths for pain: paracetamol, dipyrone, physiotherapy, turmeric, local heat, that do not destroy your filters. Do not trade momentary relief for a hemodialysis machine. We have reached poison number 2, and this one is treacherous because it is invisible. It has no smell, often no perceptible taste, and is hidden where you least expect. I am talking about hidden sodium. Note that I did not say the salt on your table. The salt you put on salad or egg represents a minimal fraction of the problem. The real killer is industrial sodium added to processed foods to preserve them and enhance flavor. Sliced bread, yellow cheeses, cold cuts like ham and turkey breast, which many think are healthy, ready sauces, packet soups, and even diet sodas. Why is sodium so dangerous for the kidney? It is a matter of physics. Sodium attracts water. When you have too much sodium in the bloodstream, your body retains fluid to try to dilute this salt. This increases blood volume inside your arteries. More volume in a closed space means higher pressure. Imagine filling a water balloon until it is stretched to the maximum. Now imagine that the walls of this balloon are the delicate arteries inside your kidneys. This constant high pressure, day and night, hammers the glomeruli, the microscopic filters, until they harden and stop working. It is hypertensive nephrosclerosis. The problem is that our palate has been hijacked. The food industry knows that salt addicts. They put obscene amounts of sodium in sweet foods, like breakfast cereals and industrialized cakes, just to preserve and give texture. You eat a cake and are ingesting a sodium bomb without knowing. The safe recommendation is less than 2,000 milligrams of sodium per day, ideally 1,500 milligrams if you are already hypertensive. A single fast food snack can have double that. The solution here is to become a detective. Turn the package. Read the label. If you see ingredients like monosodium glutamate, sodium benzoate, or sodium bicarbonate, know that it is an extra load for your kidneys. The golden rule is peel more and unpack less. Return to cooking with garlic, onion, fresh herbs, lemon, pepper. In 2 weeks without processed food, your taste buds renew, and you will notice how industrialized food is excessively salty. And now we reach the top of the list. Poison number 1, the great villain, the one that, in my clinical experience and in the worldwide medical literature, is the biggest responsible for the kidney disease epidemic we live in today. It is addictive, it is omnipresent, and it is socially celebrated. I am talking about sugar and refined flours. You may be confused. Dr. Grace, I thought salt was the worst for the kidney. Salt is bad, but sugar is devastating. Type 2 diabetes is alone the #1 cause of kidney failure in the world. And what causes type 2 diabetes? A diet rich in simple sugars and refined carbohydrates that behave exactly like sugar in the blood. I am talking about sodas, boxed juices, sweets, but also white bread, white pasta, water and salt cookies, excess tapioca. This poison attacks your kidneys on 4 battlefronts simultaneously, a coordinated massacre. First front, glycotoxicity. When you ingest excess sugar, your glucose skyrockets. Excess glucose in the blood is sticky. It binds to proteins in the walls of renal blood vessels in a process called glycation. Imagine throwing hot caramel on a fine sieve. The caramel hardens and clogs the sieve. That is what sugar does to your nephrons. They become rigid and lose the ability to filter. Second front, hyperfiltration. In the initial stages of diabetes or insulin resistance, the kidney tries to compensate for excess sugar by filtering faster. It goes into overdrive. Blood flow increases pathologically, increasing internal pressure. The kidney works double until exhaustion. It is like accelerating a car in neutral until the engine blows. Third front, inflammation and uric acid. Especially industrial fructose, corn syrup present in sodas and sweets, is metabolized in the liver and generates uric acid as a byproduct. Uric acid does not cause just gout, it directly attacks kidney tissue and causes kidney stones. In addition, sugar generates a state of chronic inflammation throughout the body. Your kidneys become swollen and inflamed at the cellular level. Fourth front, the connection with obesity. Sugar is the main cause of visceral fat. This fat is not inert. It releases inflammatory cytokines that attack the kidney. And of course, excess weight increases blood pressure, closing the destruction cycle with poison number 2. It is a perfect, vicious cycle. You eat white bread with jelly, sugar, feel thirsty, drink a soda, more sugar and sodium, feel a headache from the glucose spike, take an anti-inflammatory, poison 3, and then lie on the couch because you are tired, poison 4. It is the perfect storm for kidney failure, but I am not here just to scare you. Fear paralyzes, but knowledge liberates. The good news is that, unlike chronological aging, this damage is, to a large extent, optional. You can decide to stop poisoning yourself today. And recovery can be surprising. I have seen patients who were on the edge of dialysis change their habits and stabilize kidney function for years, living full lives. How do we start the cleanup? First, eliminate sugary drinks. If you do just one thing after this video, let it be this. Stop drinking your calories. Water, black coffee, unsweetened teas. This alone can drastically reduce your glycemic load. Second, swap refined for whole, but in moderation. Whole grain bread, oats, quinoa have fibers that act like a safety net, preventing sugar from flooding your blood at once. Third, adopt the plate rule. Half your plate should be colorful vegetables, 1/4 quality protein, and only 1/4 carbohydrates. This naturally reduces sugar and sodium. And fourth, hydrate yourself. Water is the best remedy for the kidney. It helps dilute toxins, prevents stones, and facilitates filtration. But drink pure water, not flavored waters full of chemicals. Your kidneys are resilient. They want to work for you. They want to keep you clean, balanced, and alive. But they need you to stop throwing sand in the gears. Every time you choose a fruit instead of a sweet, every time you choose to walk instead of sitting, every time you season with lemon instead of salt, you are giving a gift of life to these organs. Do not wait for the diagnosis to arrive. Do not wait for the doctor to say your creatinine is high. Take control now. Look at your kitchen with new eyes. Identify the poisons. Throw away what makes you sick. Health is not made in the doctor's office. It is made in the supermarket and in your home kitchen. If this video lit a light in your mind, if you realized you were committing some of these mistakes without knowing, then my mission today was accomplished. But the real mission starts now, with you. Share this knowledge. Send this video to your parents, your children, your friends. Kidney disease is a silent epidemic, and the only vaccine we have is information. Leave here in the comments, which of these 4 poisons is the hardest for you to quit? Let us discuss strategies together. And remember, take care of your kidneys, and they will take care of you for the rest of your life. Until next time.